super depressed. I can't sleep, or I sleep too much. I can't study. I can't focus on anything. My boyfriend broke up with me yesterday because he said that I was too sad, and I can't get A's in any of my classes. I've got 2 kids at home, I'm working a full-time job, and I'm a full-time student. I don't know what to do. I can hardly get my mood up, and I don't know what's gonna help. I need something to make me feel good again.
Hey guys, I'm tired. Classes are kicking my butt. Finals are coming. I've been studying all day and all night. I can't sleep. I just need a way to figure out how to get some hours in because my body is going through it.
Hi, I'm stressed. I work at McDonald's and Taco Bell full-time. I also attend school full-time. I don't have time to do anything with my life except work and do school. My body hurts and I'm stressed and tired of a lot of things and burnt out, basically. I really need to find a way to release my stress. I need an outlet, but I don't know what that would be.
I know a way that can help all of you feel better. Exercise. Exercise makes you less depressed, less stressed, and less tired. If you exercise for at least 30 minutes a day, your body will overall feel so much better. Let me help you.
Wow.
No way!
We need to exercise, I think.
Now, we are going to show you some of the ways that you can get some exercise.
Oh, hey guys. I didn't see you there. So once I found out that exercise could help me sleep better, I decided to try running. Majority of the fact that I do not get enough sleep is due to stress, as you know, and it turns out that running actually can lower my stress by releasing mood-lifting hormones and regulating cortisol levels within my body. What it does is normalize the sleep cycle by boosting the levels of sleep-inducing hormones like serotonin, thyroid, etc. That way, the post-running drop in my core body temperature makes me sleepy and I'm able to sleep peacefully and happily. And when it comes to the effects that it has on my brain, that's so cheesy. Well, in studies done by West Michigan, Lithuanian Sports, and Nottingham University, they have shown that running can improve your cortical flicker frequency threshold. This is associated with your ability to better process information. Running also improves aspects of executive function, which would include your ability to tune out distractions, switch between tasks, and solve problems. Other studies have shown that any exercise that gets your heart and sweat glands pumping appears to boost the size of the hippocampus, which is the area of your brain involved with verbal memory and learning. And exercise overall can not only help your memory and thinking, but can also reduce insulin resistance, reduce inflammation, and can stimulate growth factors, which are chemicals in the brain that affect the health of brain cells, the growth of new blood vessels in the brain, and even the abundance and survival of new brain cells. So get out there and get active.
Weightlifting.
Oh, hey, gang.
I was too busy getting #swole. I like to weightlift because it helps me relieve my stress, reduce sadness, and have more energy throughout my day. Most studies focus on aerobic exercise, like running or jogging or being on the bike, which does help with depression and psychological well-being. But anaerobic exercise, like weightlifting, can help with increased independence and help to alleviate stress and also reduce your risk of developing several psychological disorders. According to Berger et al. In 1996, in order for exercise to be a stress moderator, it has to be enjoyable, predictable, and non-competitive. Weightlifting is none of those things. I'm fine. Weightlifting can be all of these things. Can be none of these things. Independence training also helps individuals with schizophrenia. So individuals who tested positive for schizophrenia were also put through a weight training program, and it was shown to decrease cortisol levels and increase their ability to master practices and feel like they're independent, which helped to reduce schizophrenic positive symptoms. So, as you can see, stress helps? No, stress doesn't help. Weightlifting helps reduce stress, up your mood, and decrease your susceptibility to multiple psychological disorders. It's also really good because it helps you get those muscles.
How tumbling relates to mental health is that it helps me. It is my stress reliever. Anytime I'm having a bad day or something's just not going away, I'm like, let me just go do a couple handstands or let me do a couple back handsprings. It helps me release my stress. It may not be the same for you, but if you have a passion for it, it will definitely help release your stress and overall improve your mood.
Stretching and aerobics.
According to the National Alliance on Mental Health, approximately 1 in 5 every U.S. adult has experienced a form of mental illness within a given year. Approximately 1 in 5 youth between the ages of 13 and 18 experience some form of a severe mental illness. With percentages like this, it is important to promote exercise, as exercise has been shown to reduce symptoms of mental illnesses. A study was done including 40 participants. Half of those participants were told to do a certain amount of aerobic exercises, 45 minutes to be precise. The other half were just doing a At the end of the study, the results were that the group of people that did the aerobic exercise had a reduced state of anxiety. This further proves that exercise does affect your mental health. Another study was done including patients with both schizophrenia and major depressive disorder. These patients, they both did 12 sessions of 45-minute aerobic exercise. The results were amazing. The results were that both patients had cognitive increases. The patients had improved in both visual learning skills and their working memory skills improved as well. Along with the major depressive disorder patients, they actually experienced a reduction in depressive symptoms, which is huge. Along with that, they also experienced a reduction in overall anxiety state. And then lastly, the schizophrenic patients experienced a reduction in schizophrenic specific symptoms as well. While more longitudinal studies need to be done on the basis of exercise improving mental health and reducing mental illness symptoms, these are great findings nonetheless.
Go on!
Hey, how are you doing? Did you know that researchers have found that over the past years there has been a substantial decrease in physical activity during the transition of adolescence into adulthood? It is recommended that young adults get at least 30 minutes of physical activity 5 days out of the week, although we are aiming for 1 hour 6 days out of the week, because it is good for physical health, and it emotionally balances you out. A study by Nicole A. Van Kim and colleagues came up with a study to examine association between vigorous physical activity, mental health, perceived stress, and socializing among four-year college students. They sampled 94 four-year colleges in the United States in a total of 14,804 undergraduate students as their participants. Help Guide states that studies show that exercise can treat mild to moderate depression as effectively as antidepressants. Hey, Chick-fil-A.
Hey, my pleasure!
Are you still filming?
Yes.
Oh. Exercise can treat mild to moderate depression as effectively as antidepressant medication, but without the side effects. So it's a much healthier way than going on antidepressant medication because exercising does the same effect. Exercise promotes neural growth, reduces inflammation, and new activity patterns that promote feelings of calm and well-being.
Hey guys, swimming is my personal favorite choice of exercise. It's one that I can actually do. I have chronic pain, and so exercising, even just walking up the stairs sometimes can be too much. But swimming is a low impact aerobic exercise, which means not only is it good for me, but it causes me much less pain. So in a study done by Nancy Chase, it proves that swimming is good for people with chronic pain and other health issues. It's especially good for people who are elderly, who physically can't move joints and stuff in the water. Swimming is really good for elderly people because it puts less stress on the joints, because water reduces the pressure on all of your muscles when you're running. And so then what it reduces the pressure on your body, so it's better than when you're running, so that you're doing the same movement and working the same muscles, but you're in significantly less pain because you're putting a lot less stress on your body. And so it's great for that. They also proved that Alice Wong said, in a study done by Alice Wong, it proved that swimming helps the elderly with their hand-eye coordination. So different strokes and being able to move in the water was significantly easier. So that's another plus. So make sure to swim if you're in pain and you can't do other different activities that you would normally do. You might find it to be a great alternative.
Thanks for
Thanks
watching.
for watching.